Right. We're waiting for more folks to float in, but thank you for joining us. Hope you're finding ways to stay cool as the summer weather encroaches upon us. I think we'll go ahead and get started, and we'll send out these slides right after our presentation. So we'll talk about COVID cases and hospitalizations, as well as some of the testing options and some updates related to vaccinations and boosters. And then just a couple of non-COVID topics to catch everybody up on. You're probably aware of about the monkeypox outbreak and the latest with that. There's also another smaller outbreak, but possibly scarier, which is meningococcemia affecting a community in Florida, but we're sure, it's going to spread beyond Florida the way these things do. And then some webinar opportunities. So in terms of COVID, here's what's going on with the hospitals and also with the wastewater surveillance. We're still kind of on the upswing. There is some preliminary data coming out of Northern California that things are slowing down just a bit there. And so that obviously is very reassuring, but we really haven't seen that sign of a slowdown here locally. We've just seen our hospitals continue to stay busy with everything else, and also hospitalized patients keep trickling in, and now we've got more than 100 in our local hospitals. So, it's still mostly an outpatient issue for this surge, as it were, if you want to call it a surge, because it seems to be milder for most people, whether that's because they've been previously vaccinated, previously infected, or there's enough herd immunity that that's affecting the severity of disease. But we know that there's plenty of vulnerable people out there who are either not vaccinated at all, or they haven't caught up on their boosters, and they have comorbid illnesses. So it is something we're keeping an eye on and trying to respond to it as best as we can. In terms of the test to treat sites, the OptumServe sites are still available. And here's the links to those. And there's lots of other treatments available, and providers trying to do this work, which is great. I really want to give my hats off to all of you that are on this call that are providing the Evusheld, which is the antibody that can protect patients for 6 months at a time. For those of you that are providing monoclonal antibodies and prescriptions after testing your patients, thank you for doing that. You're really helping everyone, not only your own patients, but the medical community at large by offering those services. We really, hope to streamline even more and get these services out in the rural areas and in our underserved areas. And we've also got an eye out on our congregate settings. So our team is working with skilled nursing facilities, jails, homeless shelters, and schools to make sure that we don't have outbreaks in congregate settings. This is also a time of year when we send a lot of our kids off to summer camps, which is really always a joyful occasion. However, summer camps are also considered congregate settings. And so you just want to be mindful, especially if you're participating as a parent or a provider in those congregate settings like summer camps and overnight camps. You want to make sure you have your protocol set so that you're able to do rapid testing with antigen tests, and then have a referral partner so that you can send people that need to get medicated to get prescriptions right away. Obviously, you yourself can write that prescription if you feel comfortable, and hopefully the links that we've provided here will give you the information that you need to get people started on Paxlovid if they're higher risk. And really, it really should be anyone who's high risk, either because of age or comorbidity, should get started on pills right away. That's really where we need to go with COVID right now. In terms of vaccine updates, I have 3. The first one is that we did finally get that local memo out, and that's linked on the website there, that first link. And this basically grants permission to healthcare workers who want to get a second booster shot. So remember, a second booster shot is FDA approved or CDC approved for those who are over age 50 or immunocompromised, we really felt like we wanted to have added protection for our healthcare workers who desired to get that same level of protection that the first two groups have. So we basically granted a memo that says you have permission to get that, even though that's outside of what is the recommendation from the CDC. So you can use that memo, take it to your favorite pharmacist, and they should be able to give you a shot for your second booster. I know that the My Turn program does not reflect that. Some of you have given us feedback about that. And unfortunately, we're not going to be able to change that in My Turn. So if you are signing up for vaccines on My Turn, you're not going to be able to just say, we have a local memo from the health department to allow us to get a second booster shot. You're going to have to work with a pharmacy or with a provider who understands your need and is able to accommodate you nonetheless. Okay. Other vaccine updates include the under age 5 group, so age 0 to 5. That's on the agenda for next week, and the FDA will be reviewing it. And they, I think the signs are there that they're probably going to grant emergency use authorization approval so that we can have a rollout of the under age 5 vaccines by late June to early July. That's what my team is planning to do. We know that there's going to be a flurry of demand as soon as that decision is made. And so after the FDA makes their decision, the CDC and the Western states, meaning the CDPH, will also follow suit. And then we'll be able to provide that vaccine, which is a different dose, to the pediatric under age 5 group here locally in Fresno County. The last exciting update is about this product called the Novavax. So the Novavax is a different vaccine company. And what they've done is they've basically created a more traditional vaccine using the actual spike protein, not an mRNA, which is what's used by Moderna as well as Pfizer. So this is an actual protein that gets injected into your body, and then your body makes antibodies to that protein. So it's very much like all of the vaccines that all of us have had for a variety of other diseases. So people think that, for those people that are skeptical of mRNA technology for whatever reason, they may trust this one a little bit more. And hopefully this will help add to the options. It will drive down costs from a market perspective and also build more trust in the general population. And this is seen as a good, welcome product. It's already approved in like 41 countries, so it's not that brand new. It's just, it took them a while to get the trials and the evidence base that the FDA wants for US approval. But in some sense, it's good because they now have a lot more patient data from all around the world to say our vaccine is safe and effective. And so this is seen to be another product that's going to hit the market probably in the next few weeks to months. I'm not sure exactly when, but getting closer and closer to that time. Do you want to add anything, Dr. Zweifler, or I don't know if you had any comments. Looks like he's on the phone. Okay, well, are there any questions about vaccines or any of the updates so far? All right, we're going to talk about monkeypox. Monkeypox is growing in number. You can sort of see here, this is, I pulled this data off the CDC just now. There's over 1,000 cases of monkeypox, which is described as kind of a generalized pustular rash accompanied by fevers, lymphadenopathy, and a flu-like illness. And these 1,000 cases are really coming from the European countries. As you can see, the UK has over 300, and then just a smattering of other countries all around the world. The US has about 35 and California has 7 cases so far. Many of them are reporting intimate or sexual contact, males who have sex with men, or people that are having sexual contact with infected people are mostly who is at risk. But we know that this is just the tip of the iceberg, and we know that this is a highly contagious disease, even if people are just, rubbing up on these lesions, if they're open and weeping. So it is going to jump over and not be as closely associated with sexual contact pretty soon here with the way things are going. So that's kind of the concern. And it's concerning enough to where the CDC raised their alert level for travel to say, be careful when you travel, be careful with the relationships that you have when you travel. And so we're seeing this outbreak, blossom, as it were, all over the world. And it is something that I think we all need to be familiar with. I'm going to show you a picture on the next slide, which was a real wake-up call for us, because even though we haven't had a case yet described in Fresno County, these sure do look like things that we see all the time. Most of these can be managed at home without medications, although there are some medications, antivirals, anti-smallpox, IVIG type medications that might be needed for people that are immunocompromised, like HIV infected patients, chemotherapy patients, et cetera. And so that's where going to the CDC site, which is that first link, is really helpful, because they go through and describe some of the treatment options. There's really not a lot of evidence-based treatment here. They're really just extrapolating from smallpox history and smallpox cases from way back in the past to say these things are the things that we would try for patients who needed something more than just supportive care. Obviously, bandaging and covering these lesions so that they're not contagious, especially while the person is in a healthcare facility, is something that's paramount. And so you are going to have full contact PPE and respiratory precautions that are needed whenever these patients are seen in healthcare facilities. And that is unfortunately going to be pretty time and resource intensive. So just be mindful of that. The second link here, I really urge you to read through also. It's a great summary from LA County about what you need to know, what are the inclusion exclusion criteria, and how to do the swabs, because you really have to unroof these vesicles and swab using a synthetic fiber swab, and then just put it in a dry tube with no culture medium at all and no liquids, and then just in that dry tube transport it to the health department, who then sends the testing off to their local lab. So that's kind of what the procedure is going to look like. We do need to become familiar with it so that it doesn't get us scrambling in real time on a Friday afternoon, which is what happened last Friday. So that's why I'm just putting this out there, is we're working on it, but we really need all medical providers and all facilities to be aware of how to handle a generalized rash of unknown origin that might be monkeypox. We want you to be familiar with the basics of it, inclusion exclusion criteria, which I'm going to share on the next slide, and then how to do the specimen handling. So I know this is a lot of writing. I'm going to send this out, so don't panic. This is all taken from that LA County website. This has the case definition, which is a new rash that's characteristic and meets one of the epidemiological criteria or otherwise has a high clinical suspicion. If there's no other explanation for why this person has a rash, then basically that puts you in a higher risk of index of suspicion. And if they have close or intimate contact with a social network experiencing monkeypox activity, including the MSM community, people who are meeting partners through online websites or bars or parties, et cetera. And you can read the rest of the epidemiological criteria there. In terms of the swab preparation, I know it's cut off here and I apologize, but it's basically vigorous, firm swabbing of lesions. You have to do paired sets. So be prepared to send off 4 little swabs. So do 2 pairs from 2 different sites. Dry synthetic swabs in a tube that contains nothing else, like a sterile urine specimen cup. That's perfect. So just keep that in mind, that that's how the specimen collection should be done. And then down here at the very bottom right, transmission requires prolonged close contact. Brief interactions and those conducted using PPE are considered not high risk, and therefore PPE is what you want to go with. Even just in case it turns out to be monkeypox, you're really going to streamline your contact tracing down the line. And remember that the standard precautions are gloves, gown, surgical mask, and face and eye protection. All right. Now here's a case that we actually had at CRMC. This is a lookalike. This turned out not to be monkeypox, but it sure had us scrambling last week. So Friday afternoon, this young lady came in with a generalized rash. This turned out to be a dermatitis related to flea bites from a kitten, but it was all over her body. She certainly had some, some history that was a little bit more suspicious and made us think epidemiologically that she could be a first case here in Fresno County. But, if you start to look for generalized rashes like this, you're going to see them all the time. And so that's kind of what makes this a little bit concerning, is that it can look like so many other generalized rashes. There's actually a great webinar that's coming up on June 13th, and it's really just what you need to know. It's done by ID doctors and HIV, hepatitis C, and STD specialists that can really walk you through, all of these issues and allow you to ask questions. So I really urge you to sign up for that webinar. Here's the link to it up at the top, and that's coming up next week on June 13th. All right, another outbreak that's being tracked, at least at the national level, has to do with meningococcus. So this is an outbreak of invasive meningococcal disease in Florida. This is happening among men who have sex with men, and basically the CDC is asking that community to get their vaccines and talk to their healthcare providers. Obviously, if they're living there, then that's really a priority for that local and state health jurisdiction. But we know that people travel. LA County is very worried that basically they're going to have a lot of travelers back and forth between Florida and LA. And so that might actually affect that this might become seated in Los Angeles. And if it sets up house in Los Angeles, then you can bet your bottom dollar that it's going to be spread throughout California as well. So that's the concern here, is that, this is the very beginning. We know that it starts in a very localized area, but it doesn't stay there, and that this is something to watch as well. So I'm just putting this on your radar. I don't think anybody needs to panic about this. But obviously, if your patients are saying, hey, I'm going to go to Florida and these are my party plans, then you may want to talk to them about getting their vaccinations and making sure that they have good information to prevent this meningococcal infection from happening to them. And then last slide is that our own Dr. Solis is going to be on a panel to talk about vaccinations for COVID. This is a panel that's being organized by at a national level by the National Hispanic Medical Association. And it's really an update for those who serve Latino communities and really talking about best practices to get that community vaccinated. So you can see the registration here. This certainly applies to so many of our patients here in Fresno County. So hopefully you can join and support Dr. Solis. She's such a great physician for us. And she's becoming, as you can see, a national speaker on topics related to public health. So we want to support her doing this. Good job on this, Dr. Solis. This is coming up on June 29th. So you have lots of time to get registered, and hopefully you can join. It's early in the evening on Eastern time, so it should be in the afternoon our time on June 29th. And I think that might be all of the slides that I have, but I'm happy to take questions if you have them. And like I said, we'll share out all of these slides once we adjourn today. Any other questions or comments? Wow, everyone's quiet today. Well, hang in there. Hopefully you're getting some time to rest and recharge. And like I said, stay cool. We probably need to be doing more education related to climate and especially environmental health. I know that for the general public, we're definitely trying to message about water safety and pool safety. And you probably heard about some of the very unfortunate incidents related to drownings. And that's really just the tip of the iceberg, honestly. There's a lot of near drownings and close calls that really don't make the headlines that our emergency departments are treating all the time. So this is really the time of the year when we really need to educate all of our parents and really all of our networks about pool safety, water safety, and make sure that we can prevent as many of those as possible. So we will craft more messaging along those lines, and happy to have you contribute. And obviously, if you have ideas or if you have a presentation or webinar that you're excited about, please reach out. We have, a great community here, a very supportive community that really cross-pollinates so many great ideas, and we really should leverage that and form a conversation platform through these meetings to make everyone improve their best practices. All right, well, we'll get these slides sent out. That might be a new record for how early we're going to adjourn, but in some ways it's a good thing. Please stay in touch and let us know if we can help with anything. And in the meantime, stay well and take care of yourself. Thank you.